Why is biostatistics such a cornerstone in the medical field, you may ask? Biostatistics, my friends, is a powerful tool that applies statistical principles to biological and medical data. It helps healthcare professionals draw meaningful conclusions from their research and clinical data. But why is this important? Simply put, biostatistics allows these professionals to make informed decisions and evaluate the effectiveness of treatments and interventions. In the world of biostatistics, we deal with a variety of data types. Categorical data like yes, no answers, continuous data such as blood pressure measurements, and time-to-event data like survival rates are all part of the mix. Knowing the type of data is crucial as it determines the most appropriate statistical method to use. Now, let's dive a bit deeper. There are two main types of statistics: descriptive and inferential. Descriptive statistics provide us with a summary and presentation of data, giving us valuable insights into the characteristics of a dataset. Inferential statistics, on the other hand, use sample data to make inferences or predictions about a larger population. But to truly grasp biostatistics, you need to become familiar with some common terms. Mean, median, mode, standard deviation, confidence intervals, p-values, sensitivity, specificity, odds ratio, and relative risk. These are the building blocks of understanding and interpreting medical research. Study design is another crucial aspect. Knowledge of randomized controlled trials, cohort studies, case control studies, and cross-sectional studies is critical for interpreting research findings. Clinical trials, which are typically divided into Phase 1, Phase 2, Phase 3, and Phase 4, are another key concept. The understanding of blinding and randomization is paramount. It's also vital to recognize sources of bias in research, such as selection bias, information bias, and confounding variables. This is essential for critically appraising medical literature and research studies. And let's not forget about epidemiology. This field studies disease patterns in populations and often intersects with biostatistics. You need to be prepared to analyze epidemiological data and interpret measures of disease frequency and association. Graphs and charts are common in medical research, and you should be comfortable interpreting them. Bar graphs, histograms, scatter plots, and survival curves are all part of this visual language. Lastly, remember that biostatistics isn't just theory. It's a skill that requires practice. Solve practice questions, work through examples, and apply statistical methods to medical scenarios to solidify your understanding. In conclusion, biostatistics is a cornerstone of evidence-based medicine. A sound understanding of this subject is essential for success in the medical field, including the USMLE exams. So, as you prepare for your exams, make sure to review biostatistics principles and their application in clinical practice and medical research.